Hello you guys, and welcome back to Tuesday Tips. This is our weekly check-in. I'm Dr. Vidal here at Pure Plastic Surgery, and we meet every Tuesday for Tuesday Tips. So thank you for joining. Thank you for sending me your questions. And today we are going to be talking about breast implants. Why? Many reasons. One is because it's one of the most common questions I get. How do I choose what implant size, what cup size do I want to be after surgery, and how do I choose that? But also because Breast Cancer Awareness Month is coming up in October, and for this particular and very special month, we are having a big promotion. I don't know if you guys saw it in our stories and our social media platforms, but this is a very huge opportunity to take advantage of. So if you are booking for your surgery in October and it's a breast procedure with implants, we are giving you the implants for free. But there's only 10, okay? 10 pair of implants to be giving. So if you are considering having surgery soon and you want to take advantage of this, give us a call right away because this is gonna fly by, okay? So if you are interested in this, so this talk is gonna be very important because this is like I said, a common question I get. How do I choose the cup size I want to be? And what implant is gonna put me in that cup size? So let's talk a little bit about this. What is very important when thinking about cup sizes and breast implants is that they're not equal, okay? Cup size implants do not come in cup sizes. So to guarantee a cup size after breast implant surgery, it is impossible, okay? No surgeon can say, I'm gonna give you a B cup, like a little magician, or a C cup. We can go and examine you, measure you, and give you a recommendation to put you closer to that final goal of cup size. But you cannot fixate on one cup size. Why? Because each bra brand is different. If I go, and I'm gonna do this, I'm gonna do a video, going to a store and getting different 34 Bs, different bras. The volume is actually different. The amount of padding that they put, the amount of width on the cup size itself, it changes. And not only the volume of the breast is the width of the chest, which in every person is different. So even if two persons are the same 34C, the breast shape is gonna look different because we're all different widths, okay? So that's the other very important measurement that we do, okay? So breast implants do not come in cup sizes, they come in CCs, okay? How do I choose that CC then, okay? Well, it is important to take these three considerations, okay? So your measurements, the breast tissue that you have, and then the implant size. But these two are very important to know before jumping in this, okay? So I don't expect you to come in and say, I want to be a 350. No, I don't expect any patient to do that because you don't know these two that I am going to be able to examine and measure you on pre-op and with your goals. Then I can recommend what's the implant size for you, okay? What does help? Okay, so implant shape and breast shape and size is very subjective, okay? Like, you know, our clothing, everybody likes different shirts, everyone likes different skirts, length or forms or brands. The same for me, maybe a beautiful breast means a completely different thing from another person. So if you come and tell me, I just want them to look perky but not that big, that may mean different things from one person to another. What is very helpful is bring a picture, okay? It doesn't need to be a breast augmentation case. It doesn't need to be a person that had implants done, just the breast shape that you like, okay? I can be able to tell you by looking at the picture more, that looks more of a breast augmentation, that looks more of a more natural breast tissue, and that differs a lot from person to person. What is it that you like? Okay, the breast shape tends to be more like a teardrop, and that's the natural shape of the breast. A person that has very perky and augmented look, that probably has implants in, okay? So that you bring that picture, say, I like this cleavage, I like this shape, helps me decide what implant size is best for you, taking into consideration these two things, okay? And that is why I can't just look at a picture and recommend an implant size. I have to examine you and measure you prior to recommending an implant size, okay? Let's talk about measurements. What are the measurements that I take and are important in determining your implant size? There's one that's between the sternum or the neck and the nipple. It's called the sternum to nipple distance, okay? The longer the sternum to nipple distance, the highly likely that you'll need a breast lift, okay? Because it means that the nipple position is low and it needs to be lifted to put that implant in. Nipple to IMF or fold distance is important also to determine if you need a lift or not. And the one that is very important for implant size is the breast width, okay? Like I mentioned before, how wide is your chest? Why? Because the implants, one of the measurements that they come is the implant width, okay? So we want to choose an implant that fits your chest and doesn't look too wide. One of the things that people tell me all the time, and I do think it is true, is sometimes people with big breasts, I look larger or thicker than I really am, and that's because your breast tissue or your implant is wider than your chest, and that makes you look wide at top, which makes you look a little heavier, okay? So that's why it's so important to choose an implant that gives you good volume and fills your chest, but it doesn't make you look wider, because most of the time that makes you look thicker, okay? So the width is gonna determine how many cc's we have in each one. Also, the width, it's gonna change even in the same implant size depending on the projection. Okay, let's talk about projection of implants. So implants come in cc's and also in different profiles. Okay, different companies call it differently, but I use Allergan implants, so call it low profile, moderate profile, full profile, extra full profile. Okay, so the low profile, I believe, is too thin. The projection is how much the implant goes from the chest wall to the front, okay? How tall is it when we're looking at it in this reference? Because remember, the implant goes like this. So from chest wall to the front, how tall is the implant? Or when I'm putting it like this, how much it goes from the table up, okay? So how they work is the profile, as it increases, the implant is narrower. And that takes the implant to be rounder. This one is a little bit flatter, a little bit taller but narrower, and a little bit more tall and narrower, okay? So the moderate profile is the one that I usually use with breast lifts, okay? Why? Then this concept is very important to understand, and to also understand why some people need 2 surgeries to achieve their goal, okay? A breast lift and a breast augmentation are opposite surgeries, okay? Breast lift tightens the breast augmentation or an implant pushes out and adds volume. And it can safely, beforehand, everybody stage those surgeries, okay? It has been found to be safe, but with some exceptions, okay? It depends mainly on 2 things, okay? How much distance you have from your neck to your nipple, the sternum to nipple distance, and 2, how much breast tissue you have, okay? Those 2 things are gonna determine how much I need to lift that nipple position, which means rotating the nipple up and tightening it, okay? And 2, the breast tissue, how much tension is gonna put in the closure, okay? If you have a very long distance with thick breast tissue, that really means that I can't really put either an implant or a big implant in the first surgery, because that's gonna put too much tension on the nipple with risk of nipple necrosis and losing the nipple, or wound healing problems because the tension is too much and the wound opens up, implant exposed, we have to remove it, okay? So in those certain patients, it's better to stage it, 2 surgeries, okay? The first one with the breast lift, with or without a breast implant, small implant, depending on the severity of the distance and the breast tissue. And the second one, either putting the implant or changing the implant to a bigger one to achieve the goal of the patient, okay? So with the breast lift, I usually recommend a moderate because I don't want to put too much tension. There are very, very small cases that I can put a full profile, but that is very patient dependent. I will discuss it with the patient once they are in pre-op. It depends on the measurements, the cc's that you want, the wide or the width of the chest to determine if we can go with a full. And most of the time, if we go with a full, I'm going to put a smaller implant that I would have put with a moderate, okay? So moderate, usually with a breast lift. Full profile gives you a more augmented look. So rounder and fuller at the top than with the moderate. The moderate still gives you a good fullness, okay? I don't want you to think that with the moderate you're gonna look flat. Not at all. A lot of my breast lift with implants that you see in my social media page have actually moderate profile, and they're very happy with the cleavage, okay? Because remember that with the implant, you have to account for the breast tissue on top, okay? So it's the cc's plus your breast tissue, okay? And the extra full is really a very round implant. I don't like to use the extra full. Why? Because it's so round that it may flip. And you see this part in the bottom, that brings the implant information, size, serial number, and when this flips to the front, some people may feel it, okay? So I don't like to use the extra full in just very particular cases. The majority of times is either a moderate or a full profile, okay? So to wrap it up, what is important when choosing an implant? One, don't fixate on a CC before coming in. Fixate more on the look that you like, so you can show me pictures and describe what is it that you like more than the cup size and the cc's of the implant. Two, take into consideration your measurements and breast tissue. A 300 cc implant on a person on an A cup versus a 300 cc implant on a D cup, they look very different, okay? You have a lot of breast tissue there, so that final result is going to look completely different, okay? And number three, discuss with your surgeon, okay? I have experience with breast procedures, and I can tell you with the look that what you are wanting, your measurements and your breast tissue, what is the breast implant for you? There's always a leeway, of course, and we always discuss. I give you a range. We can go a little bit smaller, a little bit bigger, depending on your goals, and then we can make that decision on pre-op day, so we can get to the best result that you want. Okay, I'll take some questions now if you guys have.
Okay. Dr. B, what are some good supplements to take after tummy tuck to help with recovery?
Very good question. Supplements, I'm going to start you on supplements before surgery. Those iron, vitamin C, and folic acid. And those you should continue for at least 2 weeks after surgery to replenish all of the loss with the surgery hemoglobin and proteins that you lose during the surgery, okay? Other than that, other supplements that are helpful. One is arnica. I think arnica is a very good supplement for decreasing swelling, decreasing inflammation, decreasing bruising, okay? You may start arnica teas as soon as the next day, but remember that some arnica teas come with bromelain. Bromelain is also good, but bromelain may increase your risk of bleeding. So it may be taken at least 48 hours after surgery, not the first 48 hours, okay? A very good source of natural bromelain that does not increase risk of bleeding is pineapple. So that's why we recommend. I'm laughing at Willie because Willie's like, they're pineapple. Like I think he has heard this a couple times.
I love pineapple.
So that's why we recommend pineapple juice after surgery because it's very good with decreasing swelling.
Doctora, ¿habla español?
Hablo muy bien español.
¿Nos puede contar la promoción en español?
Seguro que sí. So, ahora para el mes de octubre, que es el mes de concientización, Dios mío, hablo español, pero soy puertorriqueña y los puertorriqueños pues hablamos Spanglish, en verdad, así que pues dejen paciencia. Pero pero también se dice concientización.
Sí, pero es más fácil.
Bueno, pues el mes de crear conciencia del cáncer de seno, y por eso vamos a estar ofreciendo esta promoción a cualquier paciente que se vaya a operar en el mes de octubre, que vaya a reservar para operarse en el mes de octubre con un procedimiento de seno que envuelva implantes. Le vamos a regalar los implantes, pero es solo para los primeros 10 pacientes, así que si te interesa, pues tienes que llamar rapidito porque esos implantes se van rápido.
When getting a mommy makeover, are compression garments a must? Or may we just stick to the binder for someone who's claustrophobic like me?
Unfortunately, the binder is good initially, but after the drains are out, you will need even compression. So the problem with the binder is it just covers this area, and you'll see that the swelling will start to build up lower and higher than the binder is. So for the even compression from the upper back down to your hip area to get that silhouette is better, the faja. So sorry, but try your best to wear that faja, and it's at all times only until 6 weeks. So the binder is usually worn while the drains are in, so usually 2 to 3 weeks. So it's just gonna be a couple weeks.
Okay, the next one. Would you do a drainless tummy tuck? How long is the procedure?
So let's talk about drainless tummy tucks, and you'll see that Dr. Wiggerif that just started with us is very forward and very proponent of the drainless tummy tucks, but my experience with drainless tummy tucks hasn't been great. I've done drainless tummy tucks, but I have 2 problems with the drainless tummy tucks. The way of doing a drainless tummy tuck is you have to put a lot of sutures inside. Basically, you elevate the abdominal skin to repair the muscle, and then that space is why we get fluid buildups, okay? Whenever we have empty spaces in our bodies, our body kind of fills it with fluid, and that's what happens, and that's why you have to put drains. But if you then put multiple sutures to kind of tag down that skin back to the muscle, you basically obliterate that empty space and decrease the risk of fluid buildup, okay? My problem with that technique is that sometimes those stitches dimple the skin, okay? When you're tagging that skin down to the muscle, you may see kind of dimples like cellulite, but in the abdominal wall. And that takes very long sometimes to kind of even out and forms like scar that you can feel it where all those stitches are. And the other reason why I stopped doing the drainless tummy tucks is sometimes those stitches, if you kind of do a force that you shouldn't, it may rip and bleed. And I had a patient that had a hematoma afterwards from that. So I know the drains are not very comfortable. They're only in for 2 to 3 weeks, but I've had very, very good results with them. So I prefer to use the drains.
What's the max amount of fat on cc's you have put in a BBL?
The max amount. The max has been 2 liters on each side, which is the 4-liter removal that I am allowed to do by the Florida Department of Health. But that's not very common. Usually the skin won't allow me to inject that much. So the amount that I'm injecting is basically driven or guided by 2 things. One is your skin elasticity, or how much that skin distends that I am able to inject the fat. And number 2, your goal, right? So when the skin doesn't distend all the way, the fat starts to go up and down and kind of spread, and that gives you a very square look. So I prefer to maximize the shape and get you that hourglass figure rather than giving you a very square, high hip area look.
Would you consider prescribing an anticoagulant for people traveling from the other side of the country? Blood clots terrify me, and I believe that's the reason why I haven't booked.
Yes, I do. So if, for example, I do not prescribe blood thinners to every single patient, but I do prescribe blood thinners to several of my patients, depending on the risk assessment that I do. What things I take into consideration: 1 is your age, 2, your BMI, 3, your surgery, okay? So if you're having a tummy tuck, that's the highest risk of blood clots with a cosmetic procedure. And for the traveling time, so if you're traveling more than 6 hours, I'm going to put you in blood thinners. So all of that I consider, and I talk to you in pre-op, and yes, I'm going to prescribe the blood thinners if that's the case.
Do you mesh when do you breast lift?
So it is, I don't mesh everyone, but I think it's a very, very good add-on depending on the patient, okay? I don't think everyone needs to be meshed, but I think a lot of people will benefit from it. And next week I can talk about meshes in the breast and that internal bra, what is it and why. But for patients that basically are redo breast lifts, so patients that had a breast lift and either bottomed out or the breast sagged again, I think they're very good candidates to add a mesh or the internal bra. And also for massive weight loss patients that the skin and breast tissue is very thin and it's not going to hold the breast implant, I think is a very good alternative.
What's the biggest size of implant you have used?
So the biggest size implant available for silicone is 800 cc's. The biggest I have put is 750. I have never put an 800, but I put in a 750. With saline implants, the max amount is 800 cc's. But the difference is with saline implants, you can overfill them. There is a range that you can overfill them. I think with 800 is up to 850 that you can overfill them. So that would be the biggest with saline.
We have a lot of questions, so...
Let's do it.
Yeah, doctora, ¿se puede mejorar el ombligo? Tengo 8 meses posoperatorios de un tummy tuck.
Okay.
Mi ombligo no tiene profundidad. ¿Se
Okay.
puede mejorar? Lupita.
Bueno, Lupita, todo va a depender de qué tipo de reparación de ombligo te hicieron o qué técnica utilizó ese cirujano, porque hay dos formas de hacer ombligo después de un tummy tuck. Es utilizando tu mismo ombligo y haciendo la incisión alrededor o haciendo lo que se llama un neo-ombligo, un ombligo nuevo. El problema de los ombligos nuevos es que a veces cicatrizan planos y si ese es tu caso, pues la reparación no es que no se pueda, pero es un poquito más difícil encontrar esa concavidad y que entre, ¿está bien? Hay varias técnicas que se pueden hacer, pero si estás interesado, mándanos una fotito con la consulta virtual y yo te digo qué cosas podemos hacer para mejorarlo.
Lift de brazos sin lipo, las heridas que he visto perfectas. ¿Opera con anestesia local?
No vas a creer que yo te opere con anestesia local o un levantamiento de brazos. Eso es mucha cirugía y es bien larga la incisión para tolerarlo con anestesia local. Se pueden hacer, claro que se pueden hacer procedimientos con anestesia local, pero por ejemplo la blefaroplastía o los párpados superiores se pueden hacer con anestesia local, la labiaplastia se puede hacer, pero el brazo es demasiado y va a ser la cantidad de lidocaína que te tengo que inyectar, puedes llegar a niveles tóxicos y entonces no es muy saludable ni seguro.
How experienced are you when performing mommy makeover with brachioplasty? Yes, the trifecta perfecta. I hope I don't offend you.
Yeah, no, not an offense, not at all. I do a lot of that procedure because I do a lot of massive weight loss patients. So it is a very, very common surgery to combine because massive weight loss patients tend to have multiple areas of skin laxity, and it's a procedure that it can be safely combined for the surgery and for the recovery, so I do it a lot.
Doc, Lupita, la del ombligo, dice que superó con usted.
Perfecto. Por Clara, lo más facilito, enviamos una fotito. Si yo lo hice, es tu ombligo, así que la profundidad está ahí, así que lo evalúo y te doy las recomendaciones.
Okay. Do you use Exparel for surgeries other than tummy tucks?
Not commonly, but it can be added. Usually with the benefit of the Exparel on the tummy tuck is with the muscle repair, numbing the muscle. For the other surgeries, the skin it's usually already kind of numb from the incisions, so you're not going to notice a big difference, but it can be added with other surgeries, especially breast or liposuction cases. That's it. Awesome. You guys, remember to take advantage of our promotion. Give us a call if you're interested in a breast procedure. Get it done in October and get those free implants. And I hope this helped. And I'll see you guys next week on Tuesday Tips. Take care.